Hello everyone, how are we all doing today? I trust we are all doing well. So you are welcome to this Earth Talk, and we are going to be discussing on breast cancer because it is the month of October where this breast cancer is celebrated all across the world. And this awareness program is normally bring to educate women about the causes of this breast cancer and things that can also raise their risk and how they can also prevent it. So today we are going to be looking at breast cancer and the risk factor, also the symptoms. So as we all know, cancer is when cells in our body grow abnormally because our human body is made up of cells. So we have numerous cells in the body, and each of these cells, they are performing different functions in the body. So when cells begin to grow out of control, they begin to multiply and grow out of control. This is what can lead to cancer. So cancer cells does not normally look like the normal cell in the body because of the shape of that particular cells. So cancer cell can also affect other nearby cells or healthy cells that are close to them. They can also attack them and also affect their function. Even healthy tissues in the body can also be affected by these cancer cells. So sometimes cancer cells can travel to distant part of the body and begin to grow anywhere. So cancers can travel to other part of the body, and like they can travel to the lungs, they can travel to the various part of the body. So that is why it is very important during this process whereby these cancer cells are multiplying and moving around. This is what is called the metastatic cell cancers. Metastatic cancers, because they have not traveled from one part of the body to another. So cancers can develop from any tissues in the body. They can develop anywhere. So wherever they develop, that is where they form their names. Sometimes they can develop in the ovary, they can develop in the cervix, they can develop in the breast. So wherever location that these cancer cells develop, that is what gave the cancer its name. That is where you call it cancers of the ovary, cervical cancer, cancers of the lungs, cancers of the skin, cancers of the breast. So depending on the location where the cancerous cells are found. So being our focus is going to be on breast cancer. So what you understand by breast cancer? So as we all know that breast cancer is when cells in the breast, like as I said that our body is made up of various cells. So when cells in the breast grow out of control, when they grow out of control, that cell become cancerous. So breast cancer often happen especially in the glands, those glands that carry the breast milk. Those glands that carry the breast milk, or sometimes they can also happen in the milk ducts. So those are the tubes, those tubes that carry milk from your breast to from your gland to the nipple of the breast. They can even happen at the duct. So depending on the location. So breast cancer, remember, when it is not detected on time, can kill. This is the one reason, one of the highest causes of death among women. Because breast cancer can kill more women at any time. So more than any other cancer except lung cancer. So remember, even though women have this breast cancer, I always say that men can also have breast cancer because men have breasts too. But the only thing is that it is very rare in men than in women. So knowing your breast how your breast feel like normally. Know how your breast feel like by looking at it, feeling it. This can help you to detect if there is any cancerous cell that is growing out of control. So when you notice any abnormal growth or loops of tumor in your breast, you need to meet the doctor urgently, because early intervention, early detection can really raise your chances of getting cured of breast cancer. Because if you don't detect it on time, before you know, it might spread to other part of the body, and it will be very difficult to cure. So there are so many things that can cause breast cancer, but actually there is no actually what normally causes it, but there are so many things that can raise your risk of having this breast cancer. So most of these things is what we call risk factors. Risk factor and who are most at risk of getting this breast cancer. So normally, as I said, we do not really know what normally causes this cancer, these cancer cells to begin to grow in the body. But according to studies, so many things can raise one risk of this breast cancer, like your gene, your lifestyle, and the environment around us. All this can also lower or raise our risk of getting cancer. So according to studies, remember that most of these risk factors for developing breast cancer are normally classified like your gene, your lifestyle, your environment as well. So unfortunately for women are at higher risk of having this breast cancer. Why? Being a female. Being a female raises their risk of getting breast cancer. And also for women, when you are getting older, your risk also increases, especially when you are from 45, 50 above. Getting older can also raise your risk of this breast cancer. And this is why it is so important that as a woman and as a female, you need to stay vigilant. You need to be very focused. You need to be very watchful. And in this, our awareness of this breast cancer, you need to make sure you get screening and also follow up with all the information, and also remove any barrier that often prevent effective prevention and detection of this disease. So being a female and getting older are one of the greatest risk factors that can raise a woman risk of this breast cancer. So the risk is nearly doubled. The risk is doubled if a woman has a first degree relative who has this breast cancer or has been diagnosed with this breast cancer. So if any family relative of yours, can be your auntie, it can be your sister, your mother, or any family relative, so the risk also increases. So with this is why it is very, very important. So if you have any family relative that has been diagnosed with this breast cancer, please go for screening. Screening will always help to detect if there is any cancerous cell. It will help, and the possibility of getting cured will also be very high. So when someone has this breast cancer, what are the symptoms that the person will experience? The first symptoms they will experience when you have breast cancer is a painless loops. You begin to have a loops in your breast that is not painful, a painless loop. So when you touch your breast and you feel something strong there, these are loops of tumor. So these are just a kind of cells that are forming. So these loops, they are so painless that it does not cause any pain. So that is why we always encourage self-examine of your breast to find out if you have any loops. Really go and find out what that loops looks like. What is the cause of that loops? Is it cancerous or is it just a normal loops? So if the breast cancer begin to grow, and you have not noticed it. If it begins to grow, this loop will begin to become bigger, and it may now feel hard, very strong, and stuck in one place. So when you look at the skin and over that loops, it will begin to turn. It may be warm, sometimes it may be red, sometimes it will even be swollen. So these are some symptoms of that loop that is on the breast. So looking at the skin on that surface of that loop on the breast, it will feel it will look a kind of leathery, like the peel of the skin of an orange. You will see it in the skin of an orange, and it looks like. So these are the way to let you know that this is a cancer. So if the breast cancer has spread to other part of the body, like maybe it has spread to the lungs, it has spread to other tissues in the body, the first sign you may begin to experience is trouble breathing. You'll be having trouble breathing. You will be feeling aching, also feeling weak bones, because at this time you begin to weaken the bones and the tissues around. So these are most of the symptoms you are going to be experiencing. So when you have this, please do not wait further. Do not wait further, because the percentage of getting cured and treated is still very high for you. So make sure you get screened. What are the recommended breast cancer screening for women? There are various ways you can get screened. The first one is the mammogram. The mammogram is very effective. It's an effective way of detecting any kind of loop in the breast. So S3 is also another one. That is the low dose S3 of the breast. That is, these are the best tests that doctor we have to be able to detect any changes in the breast as well, especially if the cancer is just developing. This is a vital screening that also helps to detect early cancerous cells that are growing. So this sample of tests can produce the mammogram as well, which can also detect breast cancer early if it is just growing, even though if you have not even feel the loops. So this mammogram can be able to detect any kind of loop in the breast. So even before you begin to feel those symptoms, the mammogram can detect it at its early stage. So this will make treatment more effective. And the earlier breast cancer is treated, the earlier it is, the effectiveness of the treatment. So mammograms are safe and it's generally not painful. You don't feel any pain when you go for mammogram, and any temporary discomfort is as well as what the benefit of this screening for you. So over 40 as a woman, so make sure you book for mammogram today if you are over 40, because most states they do this breast screening free of charge. It's just free. So if you are up to 40, make sure you book for mammogram test. This will help to know your breast cancer status. So to know, so this can also be helpful for you that you are not having it. So most times many countries normally carry out this screening exercise yearly for women. They carry for women especially from 45 to 54 or at age 40 if you wish. So every two years, if you do it like you did it this year, you are going to redo it again 2 years time. So every 2 years you make sure you are screening for this breast cancer as you are getting older. It is very, very important. So with this awareness, I believe we'll be able to get more knowledge how to more knowledge about this breast cancer. So in my next video, I will talk about some ways you can effectively prevent this breast cancer. I will be dropping the video next time so that you can know some of those things you are not doing well, some of those things you are using that can raise your risk as well. So we can discuss about that. So thank you everyone for joining me, and do not forget to also share to others. Thank you and stay blessed. Bye.